Hello and welcome to my YouTube channel. Today we'll be looking at something a little different. But before we start, let me ask a question. Why do you think people who are very sick, rather than go to the hospital, go to either a church, a mosque, or a traditional worshipper to seek for deliverance from such sicknesses when they could easily go to the hospital and get treated? Why do you think that people fall sick and then they attribute their sickness to certain witches and wizards or village people? Sit back while we delve into the health belief model to understand what goes on in people's mind when they take decisions like this. In the 1950s, the health belief model was developed by social psychologists, and what they did was to help explain and predict health related behavior based on how people believe based on the personal belief of people about certain diseases and treatments. In 1966, Rosenstock was the one who first conceptualized the term health belief model. The model was further received and further advanced by Becker and his colleague throughout the 1970s and the 1980s in order to help us understand why people would take certain preventive measures or they would seek certain solutions when they are sick. Health belief models explain the behavioral response among people having different health challenges, either that sickness is acute or either the illness or disease is acute or is chronic. Now, before we go further, this health model has six major components. The health belief model has six major components that influence generally the way people perceive or the way people would respond to certain illness, certain disease outbreak, or certain infection outbreak. The first component is perceived susceptibility, the next is perceived severity, perceived benefit, perceived barrier, cues to action, and self-efficacy. But before I start explaining these various components, let me explain what we mean by perceived. As the word means, we all know, I believe that you understand what perceived means. It means that as a person, as an individual, how do you interpret certain things? Let me give an instance. For instance, during the outbreak of COVID-19 virus, so many people believe that it was not real, that it was a conspiracy theory of the Western countries to wipe away the black race. Some people said, oh, it was a plan of the government to, to swindle funds and all that, and COVID-19 was not real, neither was it spreading. Some people even said that it never came to Africa, not to talk of Nigeria as a whole. So that is what we mean by perceived. What you think about certain thing as an individual, the way you interpret certain thing. So I'll go ahead to explain the six components. The first one, perceived susceptibility and severity. Now, when we say susceptibility, it means that how does an individual think that he or she is vulnerable or is susceptible to a certain illness or disease? Now, for instance, they say, oh, there's flu, and that everybody should take preventive measures. Let me still continue using the COVID-19 virus example. So they say, oh, maintain 6 feet distance, try as much as possible to use nose masks. Some people may say that, oh, my immune system is very strong. I can never contact that disease, COVID-19. I'm covered with the blood of Jesus. You have a certain way you think, and you feel that there is nothing that can happen that would make me a carrier of that disease. That is what we mean by perceived susceptibility. That means that you believe that you are prone to contacting that disease, or you are not prone to developing that disease. For instance, you will see that at the back of a cigarette pack, they said smokers are liable to die young. Yet we see people smoke every day. Some people believe that no matter how much they smoke, they can never die or develop lung cancer. Hence, they continue smoking and smoking and smoking. Let's move on to the next one. The second one is perceived severity. Now, your belief about the seriousness of that disease and the consequence would determine if you will take that the outbreak of such disease serious or not. So, if you believe that that COVID-19 is so deadly and can take your life, can cause long-term effect on your health, you would do everything possible to ensure that you never contact the disease. You will follow all the guidelines, you will ensure that you use your nose masks, you stay away from people. And you will see people who believe that during the COVID-19 outbreak, people believe that they could contact this COVID-19 and that the consequence is very dire. You will notice that they were the ones that ensured that they followed the lockdown rule. They did not come outside at all. People wouldn't believe in the severity or their susceptibility to it. They were the ones who find means to still go outside. They went to the market and all that because they did not believe that they could contact the illness. Neither did they believe that it has a dire consequence. So let me still use the smokers example to further buttress the point. So people who understand that lung cancer is very, very fatal, and I know that it will mess with you as an individual, but everyone around you will be affected financially, emotionally, and that the process is very draining. And at the end of the day, you may not even be cured from it. We'll ensure that they stay away from smoking. But people who believe otherwise would damn the consequence and keep smoking. Let's move on to the third characteristic. The third one says that perceived benefit. Now, if you believe that your health, the action you take will help reduce the risk of contacting that disease, then you will follow the rules and the guidelines. For instance, somebody will believe that if they quit smoking, they would not have lung cancer. It can reduce their chances of getting lung cancer. They would stop smoking altogether. But people believe that there are people that believe that whether I smoke or I don't smoke, the chances of having lung cancer is there. They would continue smoking. They would damn the consequence. The fourth one says the perceived barrier. Now, you look at the challenges of adopting that behavior. That is the behavior that would help you mitigate against contacting that disease. What are the challenges, right? Some people, they have withdrawal issues when they want to quit addictive behavior like smoking. Now, when they look at the challenge, what are the challenges? What are the likelihood problem I would face when I want to quit this behavior? If they see it as not too difficult, they will go ahead and quit that behavior, right? But if they see it as something that is very tasking and that they can never cope with, they would never leave such behavior. Example is, I've said it earlier, the fear of withdrawal symptoms when quitting smoking. Let's look at number 5. Now, what are the cues to actions? Cues to action refer to the triggers that encourage behavior change. The triggers that encourage. Now, one of the triggers when you visit the doctors, and doctor will tell you the risk of continuing in the actions that you would normally do that would put you in higher risk of contacting that sickness or that disease. When you read flyers, when you go through literatures, you see various adverts concerning it, you hear promotions from different angles stating the danger in that behavior. It will encourage a change in behavior. When you keep seeing day by day jingles that how tobacco is bad for your health, how smokers are liable to die young, As a matter of fact, if you visit a cancer center and you see people suffering from lung cancer, it will trigger you to cause a behavior change. Now, the last one, self-efficacy, means that your confidence in performing the behavior. Now, how confident are you? What do you have enough courage, to carry out with that change in behavior? And also the support you have, right? Smokers will believe that they have willpower to quit. If you believe that, oh, if I want to stop anything, I can stop anything, the pride in that, having that belief in yourself, will cause you to want to change. I want to believe that we understand these 6 characteristics I just explained. Now, how do we apply health belief model? Now, health belief model can be applicable when we're trying to encourage people to take vaccinations. For instance, you want people to partake in vaccinations against hepatitis B, malaria shots. You want them to use nets. This health belief model comes in handy. Also, it helps promote healthy eating, exercise, and also motivate health screening like mammogram, HIV testing, and every other things that comes with it. Now, what are the limitations of health belief model? Number one, health belief model does not consider social and environmental factor. It doesn't. All they need, health belief model focuses on individual. They fail to look at the issue of environment and also other social factors. They forget that the people that you hang around, the environment which you live, also determine the kind of attitude you would have towards certain sicknesses. They also assume that health behavior is rational. They forget that it is sometimes more social than it is rational. People don't think rationally when they want to make health choices. They forget that the people who have to think about things like finance, their belief, and they'll put into their emotions. They put their emotions into account. So when you see people that are sick and that instead of them to go to the hospital, they go to church, what are they putting in account? They are not thinking rationally. Rather, they are thinking about their emotion. They are thinking about their faith in that regard. They are thinking about their belief and trust in God in that regard. In conclusion, health belief model explains why people adopt or avoid certain health behavior by addressing factors like perceived risk and benefit. Health professionals can also design better interventions. So I have an assignment for you at the end of this class. I want you to look at a real life barrier preventing healthy behavior. And then, how can you use health belief model to address them? Give me a real life example. Maybe somebody is suffering from diabetes and the person has decided not to stop taking sugary things. How can you use health belief model to address them? Also, number 2 question, design a health promotion plan. Now consider yourself a health fitness instructor, right? Now design a promotion plan to encourage weight loss using health belief model. This is our assignment. Submit to oluwatimileyin@gmail.com. See you in the next video. Bye bye.